My name is Jonathan Cabin. I'm a facial plastic surgeon here in Arlington, Virginia, just outside of DC. And today I'm going to talk about rhinoplasty. Rhinoplasty is an interesting procedure because the nose serves two functions. It is obviously breathing, but also it sort of is a unique feature of our face. And the way I like to think about a nose is it ties the face together, kind of like a rug in a room. You don't want someone to come and say, oh wow, you have a beautiful nose. You want someone to notice your eyes, your cheeks, your lips, other features of your face that your nose allows to bring out. When I'm thinking about rhinoplasty surgery, I'm thinking about function. I want to make sure someone's breathing well afterwards or breathing better than they were before. And I'm also thinking about how can I design a nose that fits this person's face so that it blends in and it actually brings out their other features, as opposed to sculpting a nose that may look great in a museum or on a shelf, but is actually not appropriate for someone's face. There's no purpose in doing a rhinoplasty surgery on someone to make their nose look more obvious or more beautiful. Rhinoplasty surgery, by its nature, requires some anesthesia, requires you to be in an operating room. And there's a few different ways to do it. There's closed rhinoplasty and open rhinoplasty. Closed refers to doing rhinoplasty without a skin incision, and open refers to doing rhinoplasty with a skin incision. And I perform both. And depending on what the patient needs and what I have to do, I choose one or the other. The incision is placed right here on what we call the columella, and it allows more access to the nose. So when you have to do more nuanced work, you have to do more design and restructuring of the tissues below, you do need to perform an open rhinoplasty for consistency. The surgery really involves restructuring the structural parts of the nose, so the cartilage and bone that underlie the tissue. So we actually restructure that, and then the tissue is put back down on top and it takes shape. And so a lot of that has to do with understanding both the function of the nose, how these structures lead to us breathing well or lead to us moving air well or humidifying the air, and how they also lead to cosmetic features. So when I'm performing the surgery, I'm taking into consideration both. Plenty of times patients come in with breathing issues and cosmetic issues. It's very common to have both. They're actually somewhat connected. And so we're treating both in the surgery. Rhinoplasty recovery is actually relatively painless. There are some people that experience a little bit of pain. A lot of my patients don't experience much pain. There'll be pressure and swelling and bruising, but pain is minimal. There's a cast and some tape on the nose for about a week, and that comes off at the 1 week mark. There are some stitches that are dissolvable. We usually trim at that time, and every once in a while I put some packing in the nose, these silicone splints that help hold everything together that come out at a week as well. For the second week, people are usually still looking like they've had surgery, still having a little bit of bruising or swelling or things that are hard to cover up. But typically at the 2 week mark, you can be pretty confident that with potentially a little strategic cover up or some creative makeup, that you'll be looking normal for social engagements, as I like to think, dinner ready.